It's Charles Barkley with Wayfair. It's outdoor season, and my patio setup better be ready to play. That's where Wayfair wins. Patio seating, umbrellas, and grills, all delivered fast and easy. Shop wayfair.ca now.
Wayfair, every style, every home.
Welcome back. David Hertel in for Elias. Ontario's plan to increase the use of private clinics has renewed the debate about the current system in Canada. Would privatization in the healthcare system solve the current crisis? Dr. Adam Hofmann, who is the owner of Algomed, which has private clinics in Quebec and Nova Scotia, joins us now. Dr. Hofmann, thank you for your time this morning.
Hi, David. Thanks for having me.
So right now, from your perspective, how do you see the current healthcare crisis? What do you see as the causes of this crisis?
Well, I practice in the public healthcare system, and we have watched for the past 40 years or so the progressive decline of the public healthcare system. People have said COVID unmasked or revealed a lot of the cracks in the system. Those were most certainly there before, and it's done nothing but get worse over my entire career, for sure. About 10 or 15 years ago, I decided to work within the public system to try and make it better, but I found that it was way too difficult to affect any kind of change in a system that is so large with so many roadblocks and so much bureaucracy. I succeeded in creating a publicly funded private clinic before this private clinic that I made in Quebec and Nova Scotia and brought that to the government. And we had no traction whatsoever, despite it having saved over $25 million by increased efficiency. So in short, the big problem in the Quebec and, in fact, the remainder of the Canadian healthcare system as well is an excess of bureaucracy. I would go so far as to say that as much as you've heard that there's a doctor shortage in Canada, there is no doctor shortage. There's an excess of bureaucracy and inefficiency. In our particular clinics, we've managed to make doctors 10 times more efficient. We're able to get a visit with a primary care practitioner for $42. The same visit with a primary care practitioner down the street, your family doctor, costs the taxpayer $350 or more. So the question here is not what's wrong with the system. The question that everybody should be asking their ministers of parliament is why can we have a visit for $42 in a private clinic that costs over $350 in the public system? What has gone wrong?
Can you please answer that question?
Well, yes, I can actually. In fact, thanks for setting me up there.
There you go.
Yeah, the answer to that question is essentially that we use technology that we've developed and processed to make our doctors and nurse practitioners and nurses incredibly more efficient. Let me give you an example. In the hospital, I literally take out a pen and write on a piece of paper to get my notes. I have to fish around for this prescription sheet and that radiology sheet. And, we're basically built a healthcare system in Quebec on 1980s level technology.
Yeah.
And and everybody works really hard. Everybody in the public system, from the doctors, nurses to the administrators, everybody wants this to work, but they're working with technology that's 20, 30, 40 years out of date. It's absolutely no surprise that even a small private clinic like ours can achieve efficiencies of 10 times the public system. So
the question of privatization has been around for years. And right now, and I don't want you to delve into politics, but I'm just giving some background here. The CEQ has started talking about the public system using private clinics for certain types of treatments or surgeries, et cetera, et cetera. But it would be under the public system umbrella. The Conservatives have started saying, okay, we're going to have to move much more quickly towards full privatization. People are afraid of that. And in Canada, since the Canada Health Act, it's about, it's one of those sacred cows. So what do you respond to those people that say, hold on a second, I mean, you're talking about technology, sure, but going private means somehow there's going to have the two-tiered system, and we're going to lose something about access. And obviously, people start talking about the U.S. So you know where I'm going here. So tell me how you respond to all this.
I do, and my response to that is everybody has lost sight of the goal. So the goal here is access. When 1 in 3 Montrealers can't access a family doctor, we don't have a universal public healthcare system. Mm-hmm. It doesn't exist. Mm. The other thing that we do as Canadians is we define ourselves in opposition to the United States, which is a function of any two societies in close proximity. But what we do as Canadians very, very well is that we look at what's done best in the United States, business practices, policies, and we say, hey, that could work here. You know, arrogance is the luxury of a superpower. We Canadians are humble. Mm-hmm. We're resourceful. Mm-hmm. We're intelligent. We're educated. We can look around the world and say, hey, look, in France, they have a hybrid public-private system. In the Netherlands, they have a public-private hybrid system. In Australia, et cetera, et cetera. In fact, of the OECD countries, there are only 2, Canada included, that have a sort of universal public healthcare system. We're also when we cast aside the luxury of arrogance and we embrace our polite, humble Canadian origins, we can look at the dogma, the ideology. Public healthcare isn't a religion. You know, if you need a hammer,
it is for some.
Hammer.
It is for a lot of people.
I hear you, but between you and me and your listeners, it's not a religion. We are smart enough as Canadians to say, well, this job doesn't take a hammer, it takes a saw, or maybe it takes both a hammer and a saw. So why not use the strengths that come from the private system in the States or in Europe or elsewhere, where you can innovate on a small scale? And yes, François Legault is right, indirectly, in essence, because the innovation will come from the private system, and there's no reason why that can't be adopted by the public system. In fact, I would go so far as to say the only way that our treasured and important Canadian public healthcare system will survive is by learning from the agile and innovative private system that will develop in Canada.
So in about 2 minutes, Dr. Hofmann, tell me what would your fix be?
My fix essentially...
how would it work? I mean, again, how would it work? So let's just say I'll take me as an example. I don't know. I have a problem with my knee. I wanted it taken care of. How would this work in a world where the private system works hand in hand with the public?
Well, I can give you an example. Two good examples. So 2 weeks ago, an engineer who I've known peripherally signed up for one of our clinics. He had been on a 7-year wait list for a family doctor, and his knee was hurting, and there was no chance that he was going to get one anytime soon. He got a visit with us same day, an examination, an X-ray, and a referral to an orthopedic surgeon when finally it was revealed that he needed more attention than we could provide him. Same day. That's the difference between 7 years and the same day. And that was $42. The other example was a woman who also had been on a 4-year. Her name was Julie. She was on a 4-year wait list for her family doctor. She came in. We diagnosed one of our NPs diagnosed breast cancer that very day, limited stage. Got her mammogram, and she had her biopsy last week. All within basically a week of coming to us. Had she waited to be assigned a family doctor, well, I mean, the end result would have been sad and fairly obvious.
Well, excuse me for saying so, Dr. Hofmann, but it sounds almost too good to be true. I mean,
you're not the first.
I mean, what's the? I'm tempted to say, and I'm not meaning anything by this, but where's the catch? You know what I'm saying?
That's the problem. We've existed so long, treading water and trying to survive in the public healthcare system, that nobody's taken a breath to say, okay, let's think from basic principles. How do we redesign the system so that it could work the way I'm describing? It's not a fantasy. I mean, my friend, the person who signed up to get his knee checked out is an engineer. He turned around and he said, Adam, this is amazing. This is the way a healthcare system would have been designed had an engineer designed it. And I took that as the highest level of compliment. But essentially, again, technology, process, careful thinking, and forethought. And there is no, you know what, David? There's no other secret sauce in the world. No matter what you're doing, be it business or art, science, medicine, administration, public affairs, those are the secrets. That's the secret. There it is. I've given it to you.
Well, this is very interesting and a conversation that we will need to absolutely continue very soon. Dr. Hofmann, thank you very much for your time this morning.
Oh, I really appreciate it, David. Have a great day.
You too. Dr. Adam Hofmann is the owner of Algomed, which has private clinics in Quebec and Nova Scotia.